Hey, I'm Carly McMullen. I'm going to be your student physical therapist today.
Okay.
So I hear that you have torn an ACL. You had surgery a couple weeks ago, but you're out of that now.
Yes, I
How's everything feeling?
am. Not too bad, just a little bit of swelling.
Okay. So you have some tenderness and swelling in the patellar tendon here as well, right? Here in the front of the knee?
Yeah.
Okay, well, today we're going to do an ice massage. And I'm going to do it to you today, but I'm also going to teach you how to do it at home so that you can do it at home 2 to 3 times a day or after exercise or anytime it feels irritated. Okay? Okay, so first I'm just going to explain to you exactly how I'm going to do it. So what I'm going to do is take a paper cup. You can do this at home, it's really easy. So you'll fill the paper cup up about halfway or 3/4 of the way and then freeze it. And then you'll take the paper cup out of the freezer, unwrap, you'll tear it off a little bit, but leave a little paper on so you can grip it. Then you'll put your knee out straight on a surface, your couch, your bed, wherever. Just make sure you put a towel underneath because it'll drip everywhere. And what you'll do is rub a small area, about 10 to 15 centimeters, right here on your patellar tendon or wherever it's bugging you, for about 2 to 3 minutes. And it's going to feel, or 5 to 6 minutes, it's going to feel cool, then cold, then it may feel a little burny. You know that feeling. I'm sure you've iced many things before, so you know that feeling. And then it'll go numb.
Okay.
And so then you'll just do it about 5 or 6 minutes until it gets nice and numb, and that will provide for you some decreased swelling, and also will provide an analgesic feeling, so decreased pain. Sound good?
Sounds great.
Okay, I'm gonna go grab 2 cups so I can show you on myself, and then I'm gonna do it to you. Okay? Be right back. Okay, so I'm just gonna show you on my hand, because you can see that. So here's the cup, right? Just fill it up like this, freeze it. We've already done that. Fast forward. So what you're gonna do is rip off the side. Ooh! Whoops. Just went shooting out. So rip it off like this. You know, if that happens, you can just use the edge of your towel or whatever you need to use. Okay. So just wrap your towel around here. Then what you're gonna do, let's say I had a bruise right here. I wanted to have some decreased pain, so you're just gonna go in circles like this. And it's gonna get cool. I feel it being cool already right now. It's starting to get cold already. And I'm gonna go ahead and stop before I get to the burning stage, if that's okay with you. Okay, so I won't want to make you use this one because I just use it on my skin. I'm just gonna set it over here. Okay, now if you could do me a favor, swing your legs up on the bed. Go ahead and lay back. Okay, before we start, I just want to ask, have you ever had any bad reaction to cold before?
No.
Any redness, or do you have any known condition to ice?
No.
No, yeah, you're an athlete. You probably had a lot of ice on you in your lifetime, I would guess. Okay, so just take this out because it's starting to melt. Steal a little bit of that from you. Okay. Good, so we won't do the whole 5 to 6 minutes right now. I'm just going to do it for maybe 2 minutes just to give you a feeling, okay? So can you point to me exactly where it feels like it hurts?
Around there.
Just in this area here? Okay. So how does that feel?
It's cool.
Let me know at any time if it feels too painful, and at home, if it ever starts to be too painful to bear, don't push through it, just stop.
Okay.
And don't do it. And then if in that case, just don't do it again until I see you again. Okay?
That feels cold now.
Feels cold now? Does it feel, do you feel like it would feel good?
Yes.
It feels good. Good. Relieving maybe?
And that's
Just
burning now.
Perfect. We'll just do it a little longer. Maybe get to the numb stage just so you can feel it. Should get there pretty quickly.
That's numb now.
Numb now? Awesome. So that's the entire process.
Okay.
I would recommend 2 to 3 times a day, but you can do it more often if you're in a lot of pain, especially after you've done your PT or exercise at home. Does that make sense? Okay. Could you just go ahead and repeat back to me exactly what you're going to do?
Okay. So I'm going to freeze a cup of water, and then I'm going to apply to myself whenever it hurts, at least 2 to 3 times a day. I'm going to support my leg laying down on the couch on the bed, and then I'm going to rub it around the area that hurts for maybe 5 to 6 minutes. It'll feel cool, cold, then burning, then numb.
Perfect.
And then go a little bit past that for another minute or two, and that's it.
Perfect. And when should you stop or not do it?
If it hurts.
Or if you have any weird reaction?
Reactions, yes.
Okay, awesome. Now really quick, I'm sure you know how to do this, but just so I just want to make sure you mind grabbing this and
Sure.
doing it just for a minute. I just want to watch you.
Sure.
And just remember that this is, the cooling is only going to be good if you do it about 10 to 15 centimeters, so very small circles. It should be for a very small area.
Okay.
Make sense?
Yes.
Awesome. Just let you do it for another 15 seconds here. That's perfect. Great. Before we go, do you have any questions?
No questions.
Okay. So one last thing before you go, I'm going to give you this protocol sheet, and if you, just in case it has everything you need to know about the ice massage on there, can you just tell me exactly why we're doing this one more time? I just want to make sure you completely understand.
The ice is going to help reduce the swelling, and it's also going to give me an analgesic effect to sort of reduce pain.
Absolutely. So again, here, if you have any questions, you can always contact us, but you can come back to this sheet always, and then that's for you. You can take that home and keep it at your house.
Sounds good.
So before we go, do you have any other questions?
No questions.
Great.
Thank you. Hi, Ms. Shravia.
Hi.
My name's Emily. I'm going to be your student physical therapist today.
Nice to meet you.
Nice to meet you too. I understand that you've been doing some other exercises and stretches and even an ice massage on your ACL injury. So what I'm going to teach you is one more exercise for you to take home with you. And what we're going to do is the mini squat.
Okay.
The mini squats are going to help focus on your quad muscles and also a little bit of your glutes and include a little bit of posture and balance strength. Okay, so what this is going to help with is the controlling of your knee, which is very important getting in the shower, stepping out from the car, things like that. So what I'm going to do is I'm going to tell you how a mini squat works and how to perform it. Then I'm going to demonstrate it for you, and after that you're going to do it for me, and then you're going to teach me how to do it.
Okay.
And then show me how you do it at home. Does that sound good?
Sounds good.
Okay, so for a mini squat, you're going to stand with your fingertips supported on a surface about the same level of your hips. You're going to have your feet about shoulder width apart, flat on the floor, and then you are going to bend at the knees, keeping your torso straight about 45 degrees, 40 to 45 degrees. You're going to hold at the bottom from 2 to 3 seconds, and then after that you'll come back up slowly. So you'll go down slowly, come back up slowly. Some things that you have to keep in mind are to keep your feet flat on the floor, not to go on your toes or on your heels,
Okay.
and also to keep your back straight. One more thing is making sure that your knees don't go past your toes when you're going down. And then precaution is if at any point you feel pain or it's uncomfortable, then I would like for you to stop and consult with me.
Okay.
Does that sound good? Okay, so now I'm going to demonstrate it for you, and then you'll do it for me. So what I want you to do, can you see okay from there?
Yes.
Okay, so what I want you to do is put your fingertips on a surface. It could be a dining table, the sink, whatever is comfortable for you. Feet shoulder width apart, feet flat, and keeping your torso straight and your hips straight, hips strong. You're going to go down about 45 degrees, keeping your feet flat on the ground and making sure that your knees don't go past your toes.
Okay.
You're going to hold for 1, 2, 3 seconds, and then you'll come back up. And then you'll do that about 5 times first, then we'll do about 3 sets of 5.
Okay.
Okay, so now I will ask you to just tell me how you would do it, and then you can demonstrate it.
Okay, so I'm going to start with my fingertips or my hands on an even surface near somewhere that's comfortable near my hips. And then I'm going to keep my feet flat on the ground, and I'm going to sit back and keep my knees behind my toes and keep my upper body at about 45 degrees of an angle. And I'm going to hold it for 3 seconds at the bottom, and then I'm going to come back up.
Okay, so something that you said is you'll keep your torso straight. You're going to bend at the knees about 45 degrees.
Okay.
But that was very good. How long would you hold?
For 3 seconds.
Okay, and then what are some precautions that you would take?
I would make sure that my knees don't go past my toes.
And then if it hurts,
I would consult with you.
sounds good. So now I'll let you do it, how you would do it at home.
All right, so I'm going to bend my knees and sit back, hold it, and come back up.
That was very good. Okay, so now that I've seen you do one, I would like to see you do a whole set of 5, just to make sure that that's a good starting point for us, okay? So
Okay.
whenever you're ready. So we'll start with 5, and then progressively we'll start to increase the number of repetitions. So for now, I would like for you to do maybe 3 sets of 5 once a day. Okay. So it seems like you know your instructions. So I will just make sure they are here on a handout for you in case you do forget them. So there's that. Do you have any other questions for me?
I don't think so.
Okay, sounds good. All right, great. Thank you.
Thank you.
Hi there, how are you doing today?
I'm good. How are you?
Good. How's your knee feeling today?
A little bit better.
Good. Well, you're 2 weeks post-op. I know you've been working with the other therapists on the ice massage, and you're learning some other home exercise programs. Today, we're going to learn another exercise for you to take home. It's called a heel slide. Okay. So basically, first, before I begin teaching you the exercise, I just want to go over, I know you're a great basketball player and you're very athletic, but I do want to go over some other daily functions that you think you need to bend your knee for, because this exercise I'm going to teach you, the heel slide, it's going to help you get full range of motion so you're able to fully bend your knee. So can you think of some daily activities that you would do?
I need to bend down to feed my dog.
Bend down to feed your dog, that's really important. And what about some other activities such as like driving, simple walking, running?
Yeah, all of those things. Extra training.
Yeah, okay, good. So you can see how this is going to be an important exercise for your daily activities, in addition to getting you back to playing basketball, right?
Yes.
Okay, good. So today what we're going to do, first I'm going to explain the exercise, and then I'm going to demonstrate the exercise for you. And then what I would like you to do is explain it back to me and demonstrate it for me as if you were performing the exercise at home by yourself, okay?
Okay.
Does that sound good?
Sounds great.
Okay, so first I'll explain it to you. And the heel slide is basically you're going to be laying on your back. Either you can be, I wouldn't say a bed, but a more firm surface. So probably your floor with like a mat, or if you have a yoga mat or at home or something along those lines, or just a carpeted area. Go ahead and lay flat on your back. And then from there, we're going to bend your non-operated leg, and you're going to have your operated leg out straight, okay? And then from there, I want you to move your heel towards your bottom, okay? And I want you to, your heel will remain on contact with the floor. And I want you to always remember to have your knee facing the ceiling and your toes facing the ceiling as well while you're doing the motion, okay? So we're going to do that. When you pull your knee in, I want you to hold it for about 5 seconds. You're going to feel a stretch, but it's going to be not a painful stretch, a comfortable stretch, okay, in the front of your knee. And I want you to hold it for 5 seconds, and I want you to do about 10 reps of that. And then I want you to perform this exercise 3 times a day, okay? All right, so now I'm going to perform the exercise here on the bed so you can see what it looks like, okay?
Okay.
All right, so again, what I want you to do is go ahead and lay down on a flat surface, firm surface, so either your carpet at home in your living room or on a yoga mat on the floor. Go ahead and bend the non-operated knee. Your operated knee will be, leg will be straight. And then with your heel, I want you to move it, slide it up along the floor towards your bottom. Remember to keep your heel contact with the floor. Your knee should be facing the ceiling, and your toes should also be facing the ceiling. And then hold for 5 seconds. You're going to feel a comfortable stretch in the front of your knee. And then I want you to go ahead, after 5 seconds, slide it down. See, it's a little sticky for me, but it'll be a nice smooth transition. Okay? You're going to do this about 10 times. Hold for 5 seconds, and I would like you to perform this 3 times a day. Okay?
Sounds good.
All right. Now what I'll have you do is first explain it to me, and then I'll have you perform it like you're at home, okay?
Okay. So I'm going to be doing heel slides on a flat surface, a yoga mat or carpeted area. I'm going to lay flat, and my non-operated leg is going to be fully extended, and my operated leg with my heel keeping contact with the ground, my toes and my knee pointing up to the ceiling, I'm going to slide my heel towards my bottom, hold for 5 seconds at a comfortable stretch, and then after that, stretch back out slowly.
Yep.
And do that about 10 times in a set, 3 times a day.
Sounds good. And what are the 2 factors you want to make sure where should your knee be facing and your toes be facing?
My toes should be facing towards the ceiling, and my knee should be facing towards the ceiling too.
Great. And just a reminder, make sure you keep your non-operated leg bent.
Bent. Bent.
All right. Now you can go ahead and show me how you will do it at home.
I would hold for 5 seconds.
Mhm. Good job. Looks like you have the movement down. I would just like to practice a set of about 5, just so I know that you're performing it correctly, okay?
Okay.
So hold for 5 seconds. Good job. All right, so what I have for you here is just a handout. It has all the step-by-step instructions that we went over today. There's also a figure here, which just shows you and demonstrates the exercise that we did today. And just to conclude our session, I would like to go over why this is an important exercise and how it affects your daily activity.
Doing this exercise is going to help with my range of motion, so I can do things like feed my dog, get in and out of the car, or continue with training.
Exactly. Great. Well, it sounds like you got it. So here, this is for you, and I'll see you next week.
Sounds good.
Okay.
Thank you.
Hi, Emily. My name is Shravia. I'm going to help you out with some exercises today.
Okay.
So what we're going to start with is we're going to do something called the straight leg raise. And what that basically entails is we're going to be working these muscles that are in your thigh, called your quadriceps muscles. And we're basically just going to work on strengthening those muscles. And what this exercise does is it isolates those muscles so that it could help with strengthening your knee.
Okay.
And I'm sure, I know you are a big athlete and play basketball, but I'm sure you want to get back to just functional movements such as walking and running, and I hear that you have a great dog, so helping with feeding your dog. And so by strengthening the muscles in the front of your thigh, what that's going to do is it's going to help stabilize that knee, and so just completing those actions will be a lot easier for you with more complex actions.
Okay.
Sound good?
Sounds great.
All right, so can you just repeat back to me just so I make sure that you know it for sure what exactly the goal of this exercise is?
The goal of a straight leg raise is to strengthen my quadriceps muscles, so I can perform more functional activities like running, walking.
All right, wonderful, perfect. So first what I'm going to do is I'm just going to describe to you really briefly just how to go about doing that movement, and then I'll go ahead and show you how to do it, and then I'll take a look at you doing it before I send you home with your exercises. Sound good?
Sounds great.
All right, so what we're going to do is I'm going to ask you to lie down on your back, and at home you can do this on the floor, maybe on a yoga mat, or just somewhere soft, so you're not getting like back pains. We don't want to add that on there.
Sure.
So you're going to lie down flat on your back, and on the leg that isn't operated on, you're going to bend that leg, and you're going to put the bottom of your foot so that it's touching the floor. So you want that foot flat on the floor the entire time. The other leg is going to be completely straight, and without lifting your back, especially your lower back, you want that to be flat on the ground. You're going to just lift your toes up towards the ceiling, thereby lifting your leg. And you'll hold it at the top just for 2 seconds, really brief, and you're going to bring it back down. Does that make sense?
It does.
All right, do you have any questions about that?
No questions.
Okay, so what we really want to do here is we want to be isolating just the quadriceps muscles, so it's really important that you don't substitute any other muscles into doing that movement. So that's why it's important that you keep your back flat on the ground.
Okay.
Make sense?
Yes.
All right, so I'm going to go ahead and show you how to do it, just so it's a little clearer for you. So you're going to go ahead and lie down on a flat surface. Oh, that's moving. Okay, you're going to lie down on a flat surface. You can keep your hands by your side, and the unoperated knee is going to be bent just like that with my foot. So notice my foot is right on the flat on the floor. And what I'm going to do is I'm going to lift the other leg straight up and just hold it for a few seconds and bring it back down. Right, and I'll do that one more time. All right, and if you notice, my back is still on the bed, and I'm not bending or like compensating for that movement at all.
Okay.
Do you have any questions about that?
No questions.
All right, if you can go ahead and show me your way of doing it, that would be great.
Okay.
And just talk me through your movement so I have an idea of you knowing what you're doing.
Okay. Do you want me to explain to you before I do it?
Yes, that'd be great.
Okay. So I'm going to lay flat on the ground on a comfortable, soft surface, and I'm going to keep my non-operated leg bent.
Yes.
The other leg straight with my toes pointing up towards the ceiling.
Perfect.
When I lay it all the way flat, without compensating with my back, curving it, I'm going to bring my leg up or my toes up towards the ceiling, hold about 2 seconds, and then bring it back down.
Yes. Perfect. All right, well that looks great. And just before I send you home, I just want to see if you could do 5 of those in a row and try to keep your form just like you did it for those entire set of 5. Okay. Looking great. All right, and last one. Awesome job. All right, that looked great. You can go ahead and sit up. So I think what we'll start with this week is just aiming to do 3 sets of 5 every day. And then next week when you come back, we can talk about how that felt and whether you feel like it was too easy, too hard, and we can adjust the repetitions then.
Okay.
And if there's ever any pain, try lowering the repetitions, and if there's any pain at all with any of the movement, just don't do the exercise until you talk to me.
Okay.
Sound good?
Sounds good.
All right, and before I let you go, I just have this sheet for you, and it has just all the information about what we just talked about and some instructions on the exercise. So if you ever forget or just need to remind yourself about how to do it, you can go ahead and refer to this. And if you just want to glance at that, let me know if you have any questions.
And how's everything?
All right, great. Well, then I'll see you next week.
Okay. Thank you.
Thanks, Emily. Bye.
Hi, Emily. My name is Liz. I'll be your student physical therapist today. How you doing?
Good, how are you?
Good, thank you. How's your knee feeling?
A little bit better.
Good. Good to hear. Well, today I'm going to teach you how to do self-mobilization on your kneecap, okay?
Okay.
So what that's going to do is that when you had your surgery, you get scar tissue under it. So with your kneecap on top, you don't want it to cling to that scar tissue. So by moving it, it kind of breaks up the scar tissue, and what it also does is that the ligaments connecting, the kind of bands of tissue connecting your kneecap to your body, they kind of tighten up, and you don't want to get them too tight. So by moving it around, it'll loosen them up.
Okay.
Okay? And what that's going to do is going to allow it to move freely, so when you're walking or doing whatever you like to do.
Sounds good.
So can you tell me what this is going to do for you?
It's going to help my kneecap not cling to scar tissue and other clinical things you said. And it's going to help keep it more mobile for things like walking.
Good. All right. So the sheet right here kind of explains what the self-mobilizations do, if you want to look at it for a second.
Okay. Looks good.
Read it over. Looks good?
Yeah.
All right, so what we're going to do, during the exercise, what you do is you just sit there, you put your legs straight out, you can have your other knee bent. You grab your kneecap, I'll show you how to do it, and then you kind of just move it up and down, and then side to side. You want to hold it for a second or two, but you want to feel a stretch, but you don't want it to be painful.
Okay.
Okay? So can you explain to me kind of what to do?
I'm going to lay comfortably, just take both legs straight.
You can have one straight, one bent, whatever's comfortable.
Okay.
It doesn't really matter.
With this leg straight, and then I'm going to grab it gently on the sides or top or bottom, and then move it to the sides, top or bottom, up and down, and it should be a comfortable stretch.
Good, yeah, and you're going to do it about 2 to 3 minutes each direction.
Okay.
Okay? All right, I'll show you how to do it. Okay, so you can come over here so you can see. Okay. So what you're going to do, have your knee exposed. You can just sit comfortably, sitting up. You want your leg to be completely relaxed, okay?
Mm-hmm.
Because if you tighten up, it's not going anywhere.
Okay.
So you want to be relaxed. First, I'm going to have you kind of feel around so you can feel where your patella actually is.
Okay.
You're going to feel the top, and you're going to feel the bottom. All right, so for the first one, you're going to do it an inferior. So you're going to kind of hold by the top, and you're just going to push down. See how my kneecap moves? Yeah. Good. So you're gonna hold it there and relax. Hold it there and relax. Okay? And then you're gonna go the other way. So you're gonna go towards the bottom, right on top. Kind of grab your knee just for support. Then you're gonna squeeze down, hold it, and relax. Hold it, and relax. So for the next one, what you're gonna do, you can go to the left. You're gonna grab it with both your thumbs, and you're just gonna push towards the inside, hold it, and relax. Hold it, and relax. Then the other way, try to relax, push it, hold, relax, hold, relaxed. And then for each motion, you want to do about 2 to 3 minutes. Now I'm going to have you get up here, I'll show you, and then I'm going to have you do it to yourself, okay? Looks like. Watch out, the table moves. Alright, good. So first we're going to do the one going down, okay? So what you're going to do, you're going to stand over here, grab your leg, you're going to feel, here's the top, here's the bottom. You want to try to feel it? Sure. Top, bottom. Yep, good. Alright, so now you're going to go towards the top, you're going to push down, kind of feel it moving? Mm-hmm. Any pain with it? No pain. Good. Hold it there a second or two, then relax. Hold it, and relax. So you're going to do that for about 2 to 3 minutes. Okay. And then we'll do the one towards you. It's kind of difficult for me to do, but I'll just do it so you can feel how it's supposed to feel, okay? So you're going to hold here, kind of towards the bottom part of your patella. Mm-hmm. You're going to press down and relax. You feel that? Yes. Feel that stretch? Yes. Any pain? No pain. Good. So 2 to 3 minutes that way. Coming inside, you're just going to have to kind of come around so your thumbs can come up on the side. Press. Relax. Press. Relax. Any pain with that one? No. Good. And then this way. Let me come this way. Hold. Relax. Okay? Okay. So can you show me all those?
Sure. So I feel for the top and the bottom,
Okay.
and then for going towards my toes, I just push down and relax, and again.
Good. You want to make sure you can feel the stretch,
Okay,
but you don't want it to be painful.
okay. Then this way, press down and feel the stretch, and then relax.
So
And
I'm going to have you do the one towards your toes for,
okay,
you do it for a minute.
okay,
I'll time you.
okay.
And relax. Make sure you relax in between. You don't want to hold it for the whole minute.
Okay.
Relax. Good. All right, that's a minute.
Great.
Great. So remember, you're going to do it 2 to 3 minutes, okay? And then
Okay.
you're going to do it towards you, how you just showed me for
Okay.
a minute.
Okay. Do I show you?
Yep. You want your hands more on top of it so it'll move more. There you go.
Okay.
Good. Feel the difference from where you had them before?
Yes.
Good, that's a minute. Great. So you remember the other ones?
Yes.
Yep. You can come around, make sure you get on the sides of your, yep, there you go. Get this hand out of the way a little just so you can, yep. And really push it.
Is that better?
Yep. For a minute.
Okay.
All right, good. Great. And now you're going to come towards me, okay? Yep. Okay. And then
Any pain with it?
No pain.
You feel the stretch?
I do.
All right, good. That's about a minute. Great. All right, so can you explain to me why we're doing this one more time?
Yeah, we're doing it so my kneecap won't get attached to the scar tissue, and it'll help mobilize the other ligaments around it to help with functional things like walking and running.
Good. And can you kind of explain to me how you're going to do it?
Yes. So using my thumbs, I'm going to feel for the top and the bottom of my patella, and then also the sides. And then applying some pressure over the top of the edge of the patella, I'm going to push down.
You can show me too.
Oh, okay. Hold for a couple seconds and then relax, and do that 2 to 3 minutes. Towards my toes, towards me, towards you, and then towards the inside.
And then how long did you say it was going to be?
2 to 3 minutes each way.
And how do you know you've done it?
I feel a
So long.
stretch.
Good. All right, you got it. Sounds good.
Great.
Good luck. Thank you.
Thank you.
What's going on?
Hi. Y'all almost done or no?
Oh, I feel like Natalie.
Why do you feel like Natalie? Oh.
Attention.
It's broken now. Like, fix it.
Natalie was after soccer. When Professor Nichols says Natalie's name, Natalie, I think of Love Actually.
Okay.
A 45-minute video of us just dancing.
We should have just made a rap of all the exercises.
How would that go? How would that go?
Oh, let's hear it.
I don't know, you'd probably start with, you tore your ACL.
What a place.
Do you like paranormal activities? What's that? Shaky.
Oh yeah, and make the camera like.
Okay. I
Are you gonna make bloopers?
Someone else.
Okay. Emily can be patient.
I don't think so.
Okay. We good?
Yeah. You don't have to do the. Yeah.
Liz, hard at work.
So as I said before, go ahead and lay down on a firm surface, either your carpeted floor or on a yoga mat or something along those lines. You're going to bend your non-operated knee. Go ahead and slide your operated knee up to your bottom, keeping your heel touching the floor, your knee facing the ceiling, and your toes facing the ceiling as well. Hold it for 5 seconds, and then slowly straighten your leg back to the starting position. Why is she laughing at me? What am I doing?